Suicide Prevention Counseling, a noble yet heartbreaking profession by Stacy Andrea. The mission. When a person is at the edge of sanity and depression has pushed them to the literal edge of their existence, it is with a humbled honor that the suicide prevention counselor digs deep to hold on and guide them back from the abyss. What do? The work of a suicide counselor. A suicide counselor helps people who are considering taking their own lives find reason to live. These counselors also provide therapy to those whose lives have been affected by suicide. But how do they help? Through counseling and therapy services, these counselors have a clear goal to identify at-risk patients who are possibly contemplating suicide, as well as to determine the level of danger that the patients may pose to themselves. These factors are then identified, and the goal of the counselor then becomes to develop patient plans for living with a main focus of learning how to deal with difficult situations. The counselor is a willing ear to let the patient explore their feelings and talk through their situations. What are they looking for? The risks and warning signs that the counselor is trying to identify may include diagnosable mental illness, usually depression, substance abuse, thoughts of death, suicide, threats of suicide, exposure to or family history of suicide, previous attempts of suicide, noticing a pattern of tying up loose ends such as finding homes for their beloved pets, saying goodbye to people, righting their wrongs, creating wills, giving away prized possessions. What characteristics would a suicide counselor need to have? When dealing with people who are under the weight and burden of depression and thoughts of suicide, a counselor must have empathy above all else. In order to be able to effectively help a patient in this situation, the counselor needs to be an expert listener who's empathetic, compassionate, and non-judgmental. With this type of counseling, time is of the essence, so the counselor must be able to remain calm in high-stress situations. What education is needed? The basic level of education that's needed to be a suicide prevention counselor is a bachelor's degree. Although states may vary in licensing requirements, this seems to be the minimum requirement. However, you can work for suicide hotlines with minimal educational background, such as a suicide prevention continuing education course provided by the QPR Institute. You can also work in this profession with an associate's degree in human services or a human services certification. In order to work in private practice, you need a master's degree in all 50 states, which also includes 2,000 to 4,000 intern hours, states exams, and continuing education each year after completion of the master's degree. You can even take the degree further and aim for a doctorate. What does this position pay? There are two basic available pay grades for this type of counseling. With a bachelor's degree, the average pay is $43,680, and with a master's degree, the average is $51,000. But where can you work if not private practice? These types of counselors work in hospitals, mental facilities, schools, clinics, prisons, human services departments, and manage suicide hotlines. But is this profession in demand right now? Sadly, suicide rates continue to be on the rise. Teen suicide is an epidemic that's sweeping the nation, and the number of veterans in need of mental health services continues to rise. Also, because of the Affordable Health Care Act, patients who have never had mental health care coverage now have this included in their medical coverage policies. Because of these factors, the number of mental health care counseling jobs is expected to increase by 29% from the years 2012 to 2022, with an addition of 36,700 new jobs. Sadly in demand, suicide by the numbers. In 2018, 48,344 suicide deaths were in the United States. In 2017, 1.4 million attempts were in the United States. In 2015, suicide and self-harm cost the United States $69 billion. In 2018, 14 people per every 100,000 commit suicide. In 2017, men are 3.5 times more likely than women to commit suicide. In 2018, 129 average suicides per day in the United States. In 2017, 7% of all youth grades 9 through 12 have attempted suicide. And in Iowa, 2017 ranked 29th out of 50 states for suicide death rates. Iowa's highest suicide death rate is between 45 and 50-year-olds, and the second highest death rate in Iowa is for people older than 85. There's no single cause of suicide. It most often occurs when stressors exceed current coping abilities of someone suffering from a mental health condition. It's so overwhelming, can we actually make a difference? The suicide prevention counselor can't save everyone. However, for the right person, this career can not only help save lives, but also change the entire course of lives. It's a profession that's mentally taxing, exhausting, stressful, heartbreaking, soul-shattering, and has the added risk of putting the counselor's own mental health at risk. The trade-off is the return. It isn't just the lives that are changed or saved, but the souls that are healed, the hearts that are mended, and the patients who find the hope to hang on for one more day. It's about healing humanity and reaching out beyond yourself to be a good neighbor. If you can look past all of the work and all of the difficulties, suicide prevention counseling is a fulfilling and rewarding career that has a great positive impact on society. It's a noble profession. If you or someone you know needs help, please call the Suicide Prevention Hotline at 1-800-273-TALK 8255. And here we've come to the end, my works cited page. I thank you for being patient. We were having some technical difficulties and the sound is not working on my actual file, so we are transferring this from a cell phone. Thank you for hanging in there.